push towards me.
We're here today giving monoclonal antibody infusions for patients who have tested positive for COVID-19.
We're going to go into the clinic and we're going to start getting you set up for your treatment, okay? Okay. So after he gets out of the vehicle, we escort him around to our clinic, and then it's my job basically as a paramedic to get the patient ready for the nurse to start the infusion. So initially we get him in there, we get him in the chair, I take an initial set of vital signs, then we get consent from the patient, and then I start the IV to get ready for the infusion. 20 gauge left IC is in, or left AC.
Patient has been consented. IV access has been obtained. We are ready for one medication.
Medication is on its way.
The infusion is a synthetic monoclonal antibody. The monoclonal antibody infusions are essentially a shortcut. We take those antibodies that your body would have formed, we infuse them directly into your body.
Infusion start time 10:14.
I'm doing continuous checks. I'm making sure that everything's running smoothly, that the pump is reading exactly what I need it to read for the medication, that the rate's going to be 100% accurate, so that we're all squared away and everything's good to go for the patient infusion.
After we start the infusion, it's for this particular medication, it's 21 minutes. After the 21 minutes are up, the infusion is stopped, and then there's a 1-hour observation period where we're just monitoring the patient, keeping an eye on their vital signs, and making sure that they're not going to have any kind of negative reaction to the medication.
In the next 24 hours or so, you might feel an improvement. I will be giving you a call.
I like to ensure the patient that I'm going to be following up with the patient. I call them within 24 hours and I follow up to see how they're doing, as well as a few days post-infusion to make sure that they're improving and they're going in the right direction.
Generally, within 24 to 48 hours of receiving the antibodies, they're reporting they're clinically feeling better, symptoms are better.
And it's very reassuring for me to know that I'm helping to provide this patient a medication that could save his life.
I care about these patients. I care a lot. Whether they're fellow service members or fellow Texans, our job as a team is to treat them and make them better. And I have a lot of pride in what we do.